Thank you for joining us today. Welcome. How are you doing? Let us know where you're joining us from. It's in Lagos. If you're in Nigeria, Abuja, where are you joining us from? Rivers, Edo State, Kanu, Kaduna. Let us know what you're joining us from. Today we're going to be having a wonderful conversation. I have two guests joining me today. So thank you for joining us. Ola of the Fertility Conversations, your go-to platform and podcast for breaking down barriers around infertility. And our mission is clear: to raise awareness about infertility and to create awareness as well about alternative paths to parenthood, to provide vital fertility education to individuals, to ensure that they are empowered to make informed decisions about their reproductive health, and of course to encourage much needed support for individuals and couples trying to conceive in our society. So welcome, thank you for joining me today. Yes, I see Abuja, thank you for being here. Where else? Where are you joining us from? Please put in the comments. Today we're going to have that conversation, your fertility journey, starting right and getting the right support. I'm going to be joined by two guests, Dr. Fache of the Procare Hospital in Abuja, and Lily as well, who's a fertility patient, and she'll be sharing her fertility journey and path to parenthood. Thank you, Florida. Thank you, UK. Thank you all for being here. Okay, so I'm going to invite Lily. Can you please, I see you in the chats. Thank you for joining us from Lagos. Can you send an invite? Thank you all for joining us, for spending your Sunday afternoon with us today. Wonderful. Thank you. It's going to be a wonderful conversation. It's really important that we keep raising awareness about infertility so people are aware about options available, but also to educate our younger generation about fertility education to ensure that they are empowered to make the informed decisions. So, Lily, hey, thank you for being here.
Hi,
Hello, how are you? And Dr. Fache,
I'm
thank
very
you for being
well.
here.
Good
Good
afternoon.
afternoon.
Good afternoon, Ola. Nice to see you.
Yeah, same here. Nice to see you both.
Thank
So I'm
you.
gonna I've just said here, so I have Dr. Fache here and Lily joining us. I'm gonna give a little introduction about both of them before we start. So Dr. Fache is a renowned consultant, obstetrician, gynecologist, and fertility specialist with decades of experience treating fertility-related issues in Nigeria. He's the MD of Procare Hospital in Abuja, a frontline healthcare facility with core expertise in assisted reproduction and minimally invasive gynecological surgeries. Thank you.
Thank you.
Welcome, Dr. Fache. And of
Thank
course, we
you.
have Lily Marama, who's an astute banker, a mother of quadruplets, and she's had her fair share of fertility challenges. So she's here to share her story, to motivate and encourage anyone that is still currently trying to conceive and seeking paths to parenthood. So I'm going to start off with Dr. Fache. Please give us a little bit of what we need to know about our fertility.
Okay.
Thank you.
Yes. Good evening, viewers. Good evening, Ola. Um, I'm just going to create a background on fertility journey is actually. But before we understand fertility journey, I'll just quickly define what infertility means. And infertility is defined as the inability of a couple, heterosexual couple, and that's man and woman, to conceive after 12 months of regular, frequent intercourse. So if they are unable to achieve conception, then they are regarded as suffering from infertility. And this 1 year applies to women who are less than 35 years old. So for those that are 35 and up to 40, that duration is reduced to 6 months. And the reason why duration is reduced to 6 months is just so as because of the age-related decline in female fertility. So we don't want them to take so long, waiting for 1 year, and age is impacting their fertility negatively. So, and for women who are actually 40, they are encouraged to begin to seek, help as soon as they start trying to conceive. So this is how infertility is defined, with variables depending on the age of the woman. It's important to mention that men also, age also, impacts male fertility, but it's not as pronounced as it affects women. And so these are the various definitions. Now, you can see, therefore, that infertility is a relative thing. It's something that creeps in over time. You don't just wake up one morning and say, I'm infertile. So it comes to people, unexpectedly, because most couples who are married desire to conceive. And so they keep trying. They keep trying, hoping, to achieve conception. And it's just a matter of time before they realize that, oh, this is not coming. And that is where the infertility journey now, an unexpected, undesired journey, starts. And so because of the paucity of information, that is, correct information now, the pattern, the manner with which people who suffer from infertility seek help, it's really very concerning. And so that is where this whole idea of discussing the infertility journey, how to start. How do you start this journey? You can liken it to traveling to a country that requires a visa. You don't just go to the airport and say, oh, you want to travel to that country. Before you go, you would want to do your research. You want to ask, what are the requirements? And you want to get it right the first time. Because you don't want to be refused visa, as it may impact your subsequent application. So people go through this, and that is the way that the fertility journey should be approached. When you realize that you are probably having challenges with infertility, with fertility, then you should be able to do your research. Who do we need to see? And then you narrow down to fertility specialist. When you get to fertility specialist, then you begin to narrow down who among the various recommended fertility specialists should I see. Now, this is very important because we've seen a lot of people who are not aware of this age-related decline in fertility. And so what happens is they waste their time, so by the time they are coming to you, the cost, the initial problem, they may have multiplied. Maybe someone who probably had hormonal issues the first time now has fibroid that is going to affect, and other medical issues, hypertension, diabetes. So age is not just it's not friendly to fertility. And so when you make the right decision the first time, it helps you get your results quicker and cheaper in the end. But most times, this concept of penny wise, pound foolish, people feel that they are reducing costs. And so they begin to move from one roadside diagnostic center to laboratory to run tests. These tests usually are done on days that are not the correct days. So somebody is coming to say, oh, I have done hormonal acid. And then you're asking, which day of your menstrual period was it done? So I just went into the lab and I told them I want to run hormonal acid. And then they run the test. So the values they're going to get will be difficult to interpret. And so because they are just normal values there, they tend to interpret this. And you see women, somebody says, oh, I have gone to do a scan somewhere. They told me I have fibroid, but I was told that the fibroid is small. It's not a problem. And so by the time we're evaluating this fibroid, we would realize, because we know that it's not just the size of fibroids that matter, the location also matters. So this fibroid that is regarded as being small is located in maybe inside the cavity of the womb, and so it's really going to impact negatively on conception. So these are some of the challenges, like getting it right the first time seeking the help of fertility specialists. So I'm just going to like, who actually is a fertility specialist? How long does it take to become a fertility specialist on average? So I'll tell you, for a doctor to become a doctor, first degree, like in the university, you spend minimum of 6 years. And then you spend another 5 years to become a specialist. That's 11 years. That is, these are under standard conditions where there are no ASU strike, there are no, repeat. So, and then after becoming a specialist gynecologist now, you need to go for post-fellowship training, which takes between another 1 to 3 years to become a fertility specialist. So it means that even the regular gynecologist is not a fertility specialist. Now, how does, so it takes like, 14, 15 years to become, a specialist. This includes doing apprenticeship under maybe other senior fertility doctors. And so, even within the medical community, we recognize that fertility is this so important that it takes this training and extra training to become a fertility specialist. How do you think that someone who has just been taught how to do ultrasound and operate X-ray, maybe in the university or in the polytechnic, can compete or give you the same service like a fertility specialist? I'm talking about how long it takes for a doctor to become a fertility specialist, even after having to do additional training after becoming gynecologist. And so someone spends average of 12 to 15 years, and so it's not something you just, emphasizes the importance of infertility, because if it takes us that length of time to become specialist in that field, then it's not something you want to just dismiss and then be moving from one roadside, laboratory, side laboratories and ultrasound centers in the search for the cause of your.
There's no sound. Someone is saying there's no sound. Can you hear? Sorry, Dr. Fache,
Can you hear me?
Can you hear us? Please put
I can
in the
hear.
comments. Yeah, I can hear as well, but someone said there's no sound. Okay.
Okay,
So go ahead,
if you
Dr.
can hear
Fache.
me, then most likely
I can hear it. Yes.
Yeah. So, that's it. Actually, so this is just to create a background to like how to start right, and then getting the right information, seeing the right people early on, and then so at least even if it's for that guidance, so it's okay. This is the cause of your delay. And so this is the steps you should take in, resolving it. Then you can decide whether you want to follow that recommendation or you want to take another course of action. So I will stop here. So now maybe Lily can share her story, and then I'll take questions, if that's okay.
Yes, that's perfect. So thank you all. Thank you so much, Dr. Fache, for giving us that intro. And if you haven't heard before, if you're just joining us now, we have Lily, who's a fertility patient. She's a mom of quads, and she wants to share her fertility journey with us and let us know the options that she explored to get her where she is right now. So welcome, Lily, and thank you so much for joining us.
Thank you, Ola. Good afternoon, everyone. I'm so excited to be part of this live broadcast today. So I'll just go straight to the point. I got married in 2012, and at that time, I didn't really think much about getting pregnant immediately. So my husband and I decided to wait for a year, and just take things slow and see where it goes. So we stayed 1 year, and then we were like, okay, it's time to start. At the back of my mind, I thought, oh, it's just a walk in the park. We wanted 3 children, so we just get pregnant maybe by 2013, and then have our 3 children with maybe 2 years spacing and all. So 2013 came, and towards the end of that year, nothing was happening. But it wasn't even a problem for me at that time, because I felt I was still young, time was still on our side and all. So I think early 2014, I was ill. I had malaria. So I went to the hospital, and the doctor that attended to me was asking me how many kids I had, if I was married. And I told him I was married, been married for 2 years, and I didn't have any kids. And he was like, you're not bothered. I told him I honestly was not bothered. And he asked if my husband was bothered. I said, no, well, we're not bothered. We're still just trying to see how it goes. So he was the one that told me that for me, I would start asking questions and getting concerned. So he encouraged me to see a gynecologist to even get checked to know if everything was okay. And that's where I see the journey started. So I saw a gynecologist, and they ran some tests, like the basic tests, hormonal assay, and some few other lab tests. And they did a scan, and I think they were trying to say, oh, you have PCOS and all. But at that time, it was still, they weren't sure yet, because it was still early. So I was placed on some medication, and the journey continued from there. So in that 2014, I kept seeing the gynecologist, and no result was coming out of it. But even at that time, I was still not worried. So 2014 passed, and then one day I went to see this same gynecologist, and unfortunately she was not around. Or would I say fortunately or unfortunately, she was not around. And they asked if I wanted to see another doctor, and I was like, no problem, instead of waiting for her. And I was sent to see Dr. Fache, and we had to start all investigations all over again. We did some lab tests and all. He placed me on some medications, and it didn't seem to be working. So I think at that point it was established that I had PCOS, but I was not seeing my periods regularly. I could go 3-4 months without seeing my periods, but it wasn't even a problem for me. I didn't think much of it at that time, because I always used to have very heavy flu. So if my period doesn't come, I'm very fine with it. And in fact, I'm okay with it. So we continued like that, and he now sent me to go for HSG. Very painful, I must say. So we went for the HSG, and the result came out, and they're like, bilateral tubal blockage. And I was like, okay. But I think he had more faith than me. He was like, no, I don't want to believe your tubes are blocked. I don't want to take that result. So I'll send you for a laparoscopy. Let's really know if the tubes are really blocked. Outside of that, my husband was checked, everything was fine. His semen analysis was fine, everything was okay. So it was just on my own part. This was going into 2015. So we went for the laparoscopy, and I think everything was okay, right, Dr. Fache? I think everything was okay.
Absolutely. The
Yes.
tubes
So
were
now,
very open, so they were not
Wow,
blocked.
that's amazing, right?
exactly. Yes. So we continued. Now we decided to start from the basics. We started with ovulation induction, since it's less invasive and all. And since it was just the PCOS we were dealing with, the tubes were fine. So we did the first cycle, second cycle, third cycle, no results. At the point, I just told him, I'm tired, I just need to take a break and all. So we took a break, and then we continued again with the ovulation induction. At a point, I'll just go for the cycle. I'm not even bother doing a pregnancy test, because I just felt nothing will come out of it. It's always turning out with a negative result. So we continued 2015, 2016. Then in 2017, since ovulation induction was not working, we were now left with the option of either going for IUI or IVF. But we just decided to go for the IVF, and then we went for the first cycle of IVF, had a good number of eggs that were retrieved. Everything was fine according to the doctor. And then we did the embryo transfer. We were so expectant. We were really, really, really positive that it was going to be successful. And then after we did the pregnancy test, it came out negative. At that point, I just it was really a tough moment at that point. You know, I was so sure that it was going to work out, but it didn't. God knows why it happened like that. So I took some time to just take care of myself and just rest a bit. And then we were encouraged to try again, but in between he was like, okay, let's go for a hysteroscopy and see if there's anything that we missed out all along. So we went for a hysteroscopy, and after that, we tried another cycle of ovulation induction because we also had to get funds together to go for another cycle of IVF. And then, the shocking part, we did the ovulation induction, and as usual, I didn't bother to do a pregnancy test. And then one day I was in the office, I was feeling some kind of pain in my lower abdomen. I'm a person that has a very high pain threshold, so I didn't think much of it. I was just carrying on with my work. And then after work, I couldn't bear the pain anymore and decided to go to the hospital. And lo and behold, I was pregnant and it was ectopic. So I had to have an emergency surgery. It had ruptured my tube and my tube had to be taken out. And wow.
That must have been heartbreaking.
Yeah, it was actually. I had so many questions on my mind, like why me? Why now that this ovulation induction worked and then it's now ectopic? Why did it have to happen like that? Or like I said, God knows why it happened that way. So after I recovered towards the end of 2018, yeah, that same year, we just decided to give IVF another try. That's the second cycle. We did that and got good number of eggs as just like the first cycle. Then for the transfer, went for the transfer. Everything went fine, just like the first cycle. And then time for the test came. I took the test and it was positive. To God be the glory. And I was so excited. Went to the hospital, did a blood test to confirm, and it was confirmed that I was pregnant. And then that was when the journey started, the pregnancy journey. Went for the first scan, and then the doctor was like, I can see 4 babies. And I'm like, it's not possible now. How? Like, I'm not seeing 4, it's not possible. And then he was like, okay, you can just go and get a second opinion and then let's be sure. And that was it. It was actually 4 babies. Imagine, just like that.
Wow.
From 0 to 4. And then I went on to have a smooth and uneventful pregnancy. I was going to work until 28 weeks when I was advised to stop work. Not like I was sick or anything. And, it just felt like God used these quadruplets to compensate for all the years that we had tried. The thing is, you don't just sit down and wait for God to come down from heaven to help you. You have to get up and do something, and then God will meet you halfway. So I believe if we hadn't taken that step, maybe we would have still been trying up till now. But everything things in God's hands. Like I always say, God always has the final say. But then we also have to play our own parts. It wasn't an easy journey, having all those very, very invasive procedures. I can't count the number of times I've had to be taken to the theater for one procedure or the other. But today it's all in the past. It's all history, and the quads are going on 5. They'll be 5
Wow.
next year, next month rather. And it's been an amazing journey. I just give glory to God
Yes.
for how far He brought me. Yeah, I had them in 2019. So from 2012 to 2019, we had all the back and forth, all the ups and downs, all the disappointments, the heartbreaks, and all. But it's all history now. And well, that's it.
Wow. Thank you so much for sharing. What a wonderful journey and what an amazing testimony. But I do have to say, so sorry for your loss. Ectopic pregnancies are horrible. And of course, as people don't know, which I think Dr. Fache will touch on, it can be life threatening. So
Yeah,
I
exactly.
am thankful that you got into the hospital at the right time and it was able to be sorted. And wonderful. Thank God for your cords now. So many people with wonderful comments in the comments section saying, God will thank God, and also hoping for themselves that they would also testify soon. I think for many people listening to you, you might wonder what kept you going, right? Because you have that for such a long time, and then of course disappointment. You talked about ovulation induction for so long, and it didn't work, and you start to lose faith, right? You start to wonder, will this ever happen? What kept
Yeah.
you going?
Well, I think it wasn't even my faith per se, because at a point I had lost all hope. But
Right.
you have a partner that is supportive. My husband kept telling me that you will definitely be a mother someday. And I also have a very strong family support. That's my parents and my in-laws. They've been always been great support to me. So that kept me going, because you have situations where in-laws are breathing down your neck. I never
Yeah.
had any of that. And I think that also kept me going, because that pressure wasn't there for me. It was more of personal pressure. My husband was fine with it, and he just kept encouraging me to not lose faith. And then I think Dr. Fache also had faith that would definitely smile at the end of it all. So that's practically what kept me going.
Thank you. Thank you so much for sharing. Very helpful. And we thank God for your husband, for your wonderful, supportive husband and family. I'm going to come back to Dr. Fache. We'll come back to you, Lily. Dr. Fache, anything you want to add to that journey? Because you were there from the beginning. What would you like to share or let us know?
Um, yes, just like I said, I mean, before I continue, I wish Lily's husband was part of this life, because I cannot continue without commending him. The support, the lack of pressure, it didn't, I think it just, helped the whole situation. And this is where men comes in. Most of the time, we see women come into the hospital alone. And then
Right.
you ask them, where is your husband? And say, oh, he's at home. Why is he not here? So he doesn't think he has a problem. And it's a challenge, because every time, I mean, some women have taken 5 years out of their life to run different kind of tests, take different treatment. And at the end of the day, it turns out that the man actually is the problem. There's this misconception like, oh, once a man can attain an erection and ejaculates, then he's fine, you know. But in his case, he was actually fine, very fine. But then he was very supportive, and so I mean, I would give kudos to him. And the other thing is, yes, there was the emotional support that also came from the hospital, my team as well. And of course, that wouldn't have been possible if the patient does not have faith in what we're doing. And this
Yes.
emphasizes, first of all, do your homework. So now when you get to that doctor, if things are not going, because what we see these days is everybody just want to blame the doctor when the thing is not going on well. When it goes on well, then they take the glory elsewhere. So, I mean, if you understand that you have a good doctor, then every time things don't go well, we'll sit down and say, okay, what could have gone wrong? We know that even IVF, for instance, which is the most successful out of the fertility treatment, is never 100%. There is nowhere in the world that will say, okay, oh, we do IVF and everybody we do IVF gets pregnant at a go. But when you accumulate it, yes, the numbers can go up, the percentage can go up, and it's good for people to understand. On our side here, there are a lot of economic challenges, so everybody who manages to do an IVF is looking forward to having a successful, outcome. But in better clients, when you're discussing IVF, they're already looking at you like, okay, maybe minimum of 3 cycles, because they know that it may not work the first time. So if people could pay for 3 cycles, when you fail one, you won't be so devastated because you know that, okay, you still have 2 more chances. But the way it is here is to even pay for 1 cycle. You know, some people go to, take loans, sell properties, and the rest of them. And that's because IVF, as it were, is an expensive treatment. The drugs are very expensive. And when you look at the economy as it is today, it's even worse because prices have doubled and tripled. So, but making that decision, so it was not an easy journey. And I'm happy that Lily agreed to share her story, because people just see her today, oh, mother and for not 4 before it came. And of course, it was out of the first failure. We found out that first one was very excellent. How did it fail? So, of course, human thought on the second one. In between is okay. She was really very down. She didn't even want to continue the fertility treatment. That was where I came up with, like, okay, while they are still taking your time, why don't we try this ovulation induction again?
Yeah.
And that was the first ovulation induction that ever worked. And she didn't check because she had always thought it was not going to work until she started having that pain. Turned out that it's ectopic. So we thank God for her life, because yes, ectopic pregnancy is a very dangerous condition. It's one of the conditions in gynecology that a doctor will be forgiven if you suspect it strongly and you take a woman to theater and it turned out that it's not an ectopic. You won't be seen to have done an unnecessary surgery. That's one out of very few conditions that you can have. But that's because of how dangerous it is and the fact that it has killed so many women who didn't get help on time. So her story emphasizes the challenges that when you see progress is not a straight line. It's an up and down kind of wave, and then it goes up from when she started, some of the tests that she had done that we had to do again, how we got results that didn't seem to know the tubes are blocked. And then we said, okay, no, I don't feel like, because I asked very intricate questions. So what could have led to tuber blockage? So we recommended laparoscopy, which we did, and dye test, and the tubes were just very open, So the question then was, one would wonder, why is she doing ovulation induction and eggs were seeing follicles, but then she wasn't getting pregnant? That just emphasizes the inefficiency of human reproduction. So the fact that a woman is ovulating and had intercourse at the right time, does not necessarily equate to pregnancy. There are so many processes, from the eggs being released to having good sperm that will fertilize, the eggs to enter the tube. These are things we don't have influence. So when you do ovulation induction, all that you are doing is helping the ovaries to release an egg or few eggs. But we do not have the power to influence whether these eggs will enter the tubes or not. And so a lot of times people have this misconception, oh, doctor, I checked my ovulation, I confirmed that I was ovulating, and I met with my husband, but I didn't get pregnant. Why didn't I get pregnant? And so we have to go through all these processes, fertilization. Even when the egg enters the tube, it may not be fertilized. Even if there was fertilization, the fertilized egg still needs to come and implant in the uterus. So these are all the processes that go on before a pregnancy. It is only after implantation that the pregnancy is established. And that is when a woman can test positive, when you do a pregnancy test. So all these processes that I have enumerated, if any of them is not okay, then implantation may not happen and pregnancy would not occur in that cycle. So usually for a woman that is young, usually less than 30, we estimate that the chance of conception every month is about 20%.
Wow.
Yeah. When that woman gets to about 35 and above, it drops to about 5% every month. Yeah, so that is how inefficient the human reproduction is. And so it's also the reason why we accumulate it and allow that 1 year time to say, okay, so now we are not wrongly diagnosing people. So let them try first, for 1 year if you are young, and then for a shorter period if you are older, and you are unable to achieve pregnancy, because the best test of fertility is I did and I got pregnant. If you are not able to get pregnant, then we start asking questions, where in this journey and the part of achieving pregnancy do we have a problem? And there are a few instances where it looks like it's unexplained. Now, and that is another aspect of fertility where people just, because I see a lot of patients who come in and say, oh, we have done all the tests. And then when you ask them, what tests have you done? Then they stand and say, oh, we did infection tests. So it's even very challenging in an environment where there are different kinds of doctors. Those who feel that staff can change to HIV, for instance. So they tell you they've done all the tests. And so infection tests, they have candida. And I tell them that many people, candida is so common, could be seen as if, a friend of women. So it shouldn't stop you from getting pregnant. And some of them have spent 1 year or more treating this candida over and over without doing any other thing,
Right.
Yeah, so that first step, getting the right doctor, is very, very important. And with information available, people also, and then of course it also brings the fact of getting support group like what Fertility Conversation is doing, where you can get good, correct information. You have a group of women who call themselves mama, and then all they are doing is selling their supplements to each other. And they say, mama this, mama that. And how are you taking supplement for a blocked tube, for God's sake? It's not going to work. You're taking supplement when your husband has low sperm count. It's not going to work. So people must understand that the cause of their infertility or, delay in conception may be different from the other person. So the fact that somebody used a particular medication and she got pregnant does not mean that if you go and use the same medication, because you haven't even first found out what is responsible for your own challenge. And so, when people are looking for support group, they need to look for groups that are evidence-based, scientific. Now, we'll give you scientific evidence, not somebody, because I see a lot of women, in fact, it's become like a status symbol. My own supplement is from the US. Your own is from Lokoja, so I'm better than, that's what I see. Some people have bags of supplements. And at the end of the day, they have blocked tubes, they have fibroid, and because of fear and ignorance, they're just told, oh, I don't want to remove it. Oh, somebody told me, recently I had a patient who needed to have a fibroid surgery for the second time. And as usual, I always ask them, because it's a private hospital, go and get a second opinion.
Right.
Because I don't want a situation where people come and say, well, that surgery you did was unnecessary. So then she came and said, oh, they said the fibroids are small. And I said, okay, if you look at the report, the man says they're intramural fibroids, which are fibroids within the muscle. But he also says that your wound, the lining is distorted, So in the end, we ended up taking out about 60-something fibroids.
What?
Yeah. So
Wow.
these are some of the things, like when people go to, some of this, when you go to, a place where there is a difference between testing and evaluation. When you go to a lab, I want to run it, they do a test for you. It's different from what doctors do in the hospital. We evaluate patients. So as you're telling me, and I'm asking you, oh, when was your last menses? Do you have regular, your periods regular and the rest of them? I am evaluating. There are so many thoughts coming in my head that I'm not writing down. For me to be able to, go through that algorithm in my brain and say, oh, I think this is this person's problem. So the person who, just doing ultrasound for you is not doing that. They are taught to see, so they can see fibroid, for instance, but they cannot tell you the implication of the fibroid, So this is where people need to make the distinction that if you go for fertility evaluation, not testing, where you would have at least comprehensive initial assessment to check the different points of this reproduction, like we've talked about it. Are you ovulating? Is your ovaries Are your ovaries responding to the hormonal signals from the brain? Are the tubes open? If the tubes are open, what about the sperm? Are they entering properly? Are they meeting? So you need to evaluate this, especially the female reproductive organ, one after the other, using different tests. Like she said, for instance, we had to do hysteroscopy way back then. I tell you, a lot of centers today do not still do hysteroscopy because these are emerging skills, new skills, and so that is the only way, as it were, today that you can actually have a first-hand, real-time view of the uterine cavity without having to make a cut on the woman. So you introduce a hysteroscope, which is a camera-tipped device, into the uterus, and then you're able to see. And this is where, when you look at the uterus as it is, where every fertility, it boils down to like seed and soil. The embryo is the seed at the end of the day, and the womb is the soil. So you cannot underestimate the importance of the womb when it comes to fertility. So evaluating the womb is so very crucial. And a lot of people have, missed this because they say, oh, I did an ultrasound that says my womb is fine. But ultrasound will not give you the depth of information that you would get from a hysteroscope looking directly inside the uterus. So they can at best be seen as complementary requirements. So if you haven't done all these tests, you cannot come to the hospital and say, we have done all the tests. In fact, sometimes the woman say, I have done all the tests. Say, why I? Why not we? What about your husband? He said, no, my husband is fine. So it takes another stress of 2-3 months, even sometimes 1 year. Before the man agrees to come and do tests. And behold, sometimes you just find that the man, it has been the problem all the way. So the second thing is couples should go for fertility evaluation, not just the woman. Because a lot of time, women just abrogate this problem to themselves because they are the ones that carry pregnancy. So to them, if they are unable to conceive, then it's their problem. It's a problem. Infertility is a problem of couple, not the woman. So another first step is when you finally haven't found that right doctor you want to go and see, then you guys should arrange and go as a couple. And it's quite very easy. It helps the doctor as well that the man had come the first time. His test is simple. Give us your semen. We'll analyze the semen. And if it's okay, it allows us to now put all our attention on the woman. If it's not okay and there is something that needs to be done, we would advise accordingly so that the two people can have concurrent treatment instead of concentrating on one person. Then after several years, you come and discover that, oh, the problem is even more from the man. As we've been told, when you look at the causes of infertility broadly, if you have about 100 people, in about 30 of them, the problem is solely the man. In about another 30, the problem is solely the man. And in another 30, it's a mixed problem between the man and the woman. So it means that like in half of the cases, the man is involved. Yes. So we cannot downplay this information and just focus on the women. So the men should also understand that if their wife is unable to conceive, it could be their problem. So follow the woman. You guys go to see the fertility doctor, fertility specialist, and then get evaluated so you know first what the problem. When you know what the problem is, then you now begin to think of ways to tackle it. So let me stop here for now.
Thank you so much, Dr. Fache. That was really very insightful and informative. And I think it really helps a lot of people to know, as you said, ensure that you find the right doctor and is a fertility specialist, not just a gynecologist, and ensure that you're both getting tested if you're in a relationship with yourself and your husband. Really insightful. Thank you so much for highlighting that. And of course, highlighting the fact that we want to get proper testing done and not just be buying supplemental for the internet, because again, that's very popular. And I think sometimes with IVF, which is good that we have Lily here, and of course you, Dr. Patrick, as well, sometimes people look at fertility treatments like you're playing God and not understanding that even with fertility treatments, it doesn't always work. And of course, it's still God that makes it work, even when it is successful. And of course, with Lily, you did multiple cycles, right? So it wasn't just the first time that it worked. So I think it's important that people know that it's not playing God when you do IVF or fertility treatments.
Yes, I think the aspect, first of all, there is ignorance, and there are people who are cashing in on this ignorance. It's like, let me go back to, okay, maybe a traditionalist who probably is a herbal doctor in the village, and so if you are infertile, they take you to him, and then he brands you a witch, maybe you have killed somebody, that's why you're unable to conceive. And somehow, this fertility treatment have just come to erode that power, because people that have been branded barren have been able to conceive. So there is a fight, so to say, against IVF, and I feel that some of it is deliberate, so that some people who are benefiting from this, God on earth, continue to maintain that status of, okay, if you come, I pray for you, I touch your head, and you go and get pregnant, or maybe I give you concussion. Because in actual fact, what IVF, the basic basis of IVF is there is something wrong inside the woman's body, like the tuber blockage, for instance, that prevents the egg and the sperm to meet inside the woman's body. In those days, people just assume that, maybe if you have blocked tube, it's pelvic inflammatory disease, and they begin to look at people. But we are beginning to see that a lot of our young girls and women have endometriosis. And this is a condition that causes severe pelvic adhesion, and it's not something that has to do with an act of omission or commission. We do not understand, the cause of endometriosis, but it's a very devastating disease. And so if you have blocked tubes from endometriosis, because people think, it's PID, then they equate PID, to maybe sexual promiscuity, and they feel like, it's God's punishment for the fact that the person was promiscuous and she had pelvic inflammatory disease. That's how. So we have this, maybe it's in our culture, this punitive, this judging people, punitive, just being like, if you are suffering from this, maybe God is punishing you for something. But that's not true. Some people have had surgeries, and then the surgery leaves a scar in their pelvis that have. So there are so many other. Some people have fibroids, growths in their pelvis that can cause their tubes to be blocked. And so IVF has just come to say, okay, it is possible. Since this fertilization cannot happen inside the woman's body, we can now bring out the eggs, fertilize the eggs outside with the sperm. Simple. These are microscopic things. So we bring out the eggs, mix with sperm, use big microscope to confirm whether there is fertilization, monitor them for a few days, up to a maximum of 5-6 days, and then these embryos are transferred back into their normal abode. So this is not playing God. And that's, so when even the transfer is like you're planting seed. It's not every seed that you plant that will germinate. That's why the farmers have learned to plant more seeds than they would actually require, because they know that it's not all the seeds that they plant that will germinate. So, and that's the same principle we have applied in IVF when we're doing embryo transfer. We are actually looking for one baby, but we know that all these blastocysts we're talking about, which is the stage of embryos that we transfer on day 5 or 6, are not okay. Half of them are not genetically okay. But if you want to be testing them before you transfer, then it means that so many people cannot will not be able to afford IVF.
Right.
So we just by faith say, okay, this is blastocyst, we transfer, and then allow nature to do the selection.
Right.
And so because of that, we transfer more than one, usually between 2 and 3, you know, depending on the background history of the person. How long has this person suffered? How many cycles has she had that is not successful? What's the quality of her eggs? These are some of the things we put together to determine how many embryos were put in back. Usually between, you hardly find a center in Nigeria, for instance, that's only put only one back, except if that's the only one that the woman has. So most centers hover between 2 and 3. And when you have put 3 for somebody who is very young, who looks okay, and then we could bet our certificate on her case. And that was Lily, and then the test came out negative, So when she came the second time and we had 4, good blasters, it was okay, let's put and see. And that was the time God said, okay, this is the time.
Yeah.
And then she conceived and carried the pregnancy. So this is how some of these, things that we don't do commonly happens. Occasionally you may have to go beyond the usual numbers that we transfer, and sometimes you cannot tell whether that's the time that's going to work, because like her first treatment was as perfect as this second one that worked. And it resulted into a negative. So there are still aspects of this IVF that even the scientific community worldwide do not understand, which is the dialogue between the embryos that we're transferring and the woman's womb. Visitors have come, are you ready to receive them? And the womb probably says, no, I'm not ready at this time. We don't understand that language. And so most IVF will fail at the point of implantation after the embryos have been transferred. So, and the aspect of, so people need to understand this and put this, because I wonder, why do people have malaria? And then they go to the hospital to see the doctor and take treatment. When they have infertility, it's just something, of course there is God insecure, because even the malaria we're treating, you can take the medication and you don't get well. So people need to understand, make effort and pray to God to crown your effort. Say, God will bless the work of your hand. If your hand does not have work, now what is God bless? If you are not making effort, you can't just sit down and say, Sarah got pregnant, the Bible got pregnant at 8. That's probably 1 out of many. How many people have you seen got pregnant at 8 in the world of today? So we need to be realistic and understand that some of the things, now for every innovation that comes in science, the application begins to expand. It begins to expand, and then eventually, it may now begin to, there are sides of it that may not be good. If you're looking at pregnancy termination for social reasons, it's the same way that someone who has miscarriage and have remnants in her womb, the same process of clearing that remnant is the same way that pregnancies are terminated. So it is the moral behind what you're applying it to do, Yes. So when you have IVF, the main aim is to help people who have challenges with fertility, and it's not playing God. They're just saying, okay, this egg and sperm is supposed to be able to come out inside of the body. They are unable to do so due to certain reasons. And so we bring them outside. And of course, in doing so, we now know that, it's not even people who don't have infertility. If you have, maybe if you have a partner that is AS, for instance, you guys can decide to do IVF so that we can check the genotype of the babies before putting the baby back. Right. If people want to do gender balancing, I have all boys, I want to have girl, I have girl, I want to have boy. you can decide to do IVF. And so, I mean, nowadays there are indications that are not related to infertility, family balancing, and the rest of it. If you have a genetic condition that can be transmitted to your baby, then you can decide to do IVF, not because you're unable to get pregnant, but to prevent transmission of that baby.
Right.
And then, of course, we see that it goes on and on and on. And as it expands, then some people may be applying it to uses that may now challenge the moral behind this application. So that's it. Thank you.
Thank you so much. That was really helpful, Dr. Fache. And I think it was really important for us all to hear that and to spread this awareness and information as well. So that way people are able to seek help faster and not be concerned about options. So we have a few minutes left, about 10 minutes. I'm going to spend about 5 minutes to go through some of the questions we have, and then the next 5 minutes to wrap up and get final words from you and Lily as well. So some of the questions here, for the ones that we don't get to, people can also contact Procare Hospital, Abuja after this to ask questions and perhaps have a consultation. You can send a DM. And Lily, are you open to people reaching out to you as well on DM?
Yeah, sure, that's fine.
Wonderful.
Yes, that's fine.
So you can reach out to any of us by DM if you have any further questions or questions we're not able to address in this live. So Dr. Fache, one of the questions is, what are the possible causes of tubal blockage?
Okay. I mean, I think even without I've mentioned in the course of conversation, one of the most common cause of tubal blockage is pelvic infection, what we call pelvic inflammatory disease. Sometimes these infections are so subtle that you might not know. It's not like me. It's not every time. People can have acute pelvic inflammatory disease that may have landed them in the hospital, but there are some of them that just come like, oh, I have this low abdominal pain. You know, we abuse antibiotics a lot, so you go to the next we go to the next available chemist or pharmacy, and then they mix antibiotics for us, and we take it. Somehow it works partially, and so it takes away that acute pain, but then the infection will persist. And then, of course, over time, it causes scarring of the tubes, and it can cause tubal damage. Right. The next cause, like I said, that we're beginning to see now that we do more. Now that we do more of laparoscopies, we are beginning to see that many of our women have endometriosis. When I was in medical school, we were told like, if you find women who have a pelvic condition, endometriosis is like the disease of the West. That's the white people, and our own is pelvic inflammatory disease. But we are beginning to see now that a lot of our women, that in those days have cast an expression on our women because, people tend to judge. Like you just see somebody with tubal block and you feel like this one, she has done bad things, so her tubes are blocked from infection, because that is usually the way to. But we're seeing now that a lot of our women have endometriosis, and we're doing so much at Procare Hospital to create awareness about this endometriosis and how to also treat it early, so you don't end up with tubal damage. And then, of course, masses in the large growth in the pelvis, like fibroid tumors in the pelvis, like fibroid, can also cause tubal block. So these are the major causes of course, previous surgeries, leaving scar tissue, previous pelvic surgeries can also cause tubal blockage. So these are the major causes of tubal block. And so if you have tubal block, you may want to find out whether the tubes are truly blocked by doing, because the first thing is HSG. Now, this HSG is specific to say if HSG says your tubes are open, they are likely open. But if HSG says your tubes are blocked, in some cases, it's wrong because there may be spasm at the point of introducing the dye. Sometimes the dye just leaks out as you're introducing it through the cervix, and so it doesn't fill the cavity, not to talk of spilling. So if you have a HSG that says the tubes are blocked, then it's advisable to go further to do laparoscopy which of course is it's a camera tip device that allows us, again, using buttonhole incision, keyhole incision, to look inside the woman's abdomen and confirm that's what we did for you. Are the tubes blocked or not? And so when you confirm these things, these are better done for younger women, because if you see an older woman that is probably racing against time because of age-related decline in fertility, then you may not want to be going through all this, because even if the tubes are open, that's not the kind. If I see somebody who is 40, for instance, I won't be asking the person to come and be doing fertility, start from ovulation induction, go to IUI, and go to IVF. So we may want to just recommend something that has the highest chance of fertility treatment success, which is IVF.
Thank you so much. That was really helpful. And we'll try to go through one more question, because so here, I think you noted this earlier, but I guess for some people that might have missed that, they're asking, when is the proper time to go for fertility evaluation? Is it immediately after getting married or after a year?
Okay, yeah. So we have, I enumerated this earlier, but the point I would like to add is, now we're saying that if you are, because most of these fertility definitions for some reason are tied around the woman's age. So, and then we said, if you are less than 35 and you and your husband have tried unsuccessfully for 1 year, then you may now decide that it's time to seek evaluation. If you are 35 and between 35 and 40, then your time is 6 months. After 6 months of trial, then you need to seek evaluation. And then, of course, if you are 40 and above, immediately as you are beginning to try, you can decide to go for evaluation. Now, the addition is the fact that there are factors that may also point to the fact that I may likely have problems. If I have irregular periods, then I may not, even if I am younger, I may not wait for 1 year, because that is already pointing to something. Like in Lily's case, for instance, said heavy menses, so if the menses doesn't come, she was happy, but she didn't understand that those menses are a byproduct of ovulation. So women who have irregular periods are most likely also have irregular ovulation. So if you ovulate 3 times in a year, when you're supposed to ovulate at least 10 times, then your fertility is also that less compared to somebody who is ovulating more. And that is how polycystic ovary syndrome causes infertility, because it prevents the women from ovulating regularly. It makes it difficult, even when you want to do timed intercourse, for instance, you don't even know when you are ovulating. So what are you timing? So if you have had previous pelvic surgery, or I had ectopic when I was younger or something, even maybe before I got married, then you know that you need to seek help, because at that point, you need to check whether the remaining 1 tube is okay. So these are conditions that may influence how quickly you seek fertility evaluation. Or maybe both of you, like I said, if you're marrying at 40 and you just feel like, oh, I need to. If you've done a scan before that says you have fibroid is small or something, then you may want to evaluate again. It's okay. I hope this hasn't gotten bigger, as time passed. So this, is a guide on when, the right time to seek fertility evaluation.
Thank you so much, Dr. Fache. Really helpful. And I hope that helps to answer questions for people currently watching. And of course, that's the end of the questions that we can take at this time, just to be able to wrap up within the allocated time for Instagram Live. This video will be up on YouTube, and I believe perhaps on Facebook as well. So you can check our page and also Procare Hospital to see for the video for friends or family that might want to watch it afterwards. Thank you all for being here with us. I wanted to say, as a wrap up, final question for Lily. For people listening or watching right now and still on their journeys to have children, what word of advice would you want to share with them?
Okay. My advice is always don't lose hope, don't give up, don't stop trying, because has to meet you halfway. You can only pray so much, but you also have to put in the work. So while you're praying, also get up and do something. And I believe you also testify just like I did.
Amen. Thank you very much. And Dr. Fache, any final words for people watching today about fertility that you'd like to share?
Okay, before my final words, I would like to ask you as the host, because I'm not sure I heard if you told the audience what you do at Fertility Conversations. Maybe I joined in late or something.
Yeah.
So I think before I give my final words, I would probably like you to speak to the audience what kind of support that they can get from Fertility Conversations.
Thank you so much, Dr. Fache. Thank you all for being here with us. At Fertility Conversations, we focus on raising awareness about infertility, ensuring that we provide people with fertility education so that way they're making informed decisions about that reproductive health. We're providing support to people on their journeys, trying to conceive. So we have a fertility support group. We also have a Fertility Conversations podcast available on any podcast app. And that's the first fertility related podcast in the whole of Africa. And then, of course, we're also on YouTube raising awareness, trying to encourage more support for individuals and couples that are going through fertility struggles and to remove the stigmas and taboo around infertility and pregnancy loss and alternative paths to parenthood. So certainly do reach out. We're always willing to support and direct you to the right fertility experts that you might need as you navigate your journey. So thank you all for being here. And thank you, Dr. Fache, for that opportunity to further state what we do. Thank you.
Thank you, Ola. So my final word would be to encourage people who are on this journey that there is light after the tunnel. We're trying to put the light in the tunnel so that you can actually begin to enjoy the light. So you don't even need to wait until you get to the end of out of the tunnel. So we're trying to shorten the tunnel by this information. So people need to understand what infertility is. It's not an undesired, it's an undesired journey for anybody. It's usually unplanned, but we need to understand that whether we like it or not, 10 to 15% of couples would go through a period of infertility. And so it's also not a permanent thing. That's why we've introduced the concept of subfertility, which emphasizes reduced fertility. Meaning, so usually it can be temporary because I have suffered infertility and I now have kids, so I'm not an infertile person anymore. So, but we need to understand, when is it right for us to seek help? Where do we get this help? Because when you get it wrong the first time, you can lose significant time and money. And so a lot of time people drag feet when you start telling them, oh, madam, because of your age, you may have to use egg from another person, and then they begin to feel like, no. And so they look back to say, oh, if I had probably met this person earlier in my journey, I would have been able to use my egg. So people waste time doing things. You're treating prolactin, high prolactin, 2 years on, and you're still in that place treating high prolactin. No, you need to put a timeline. If I am here and then I have a conversation with the doctor, ask the doctor, what's the timeline? What's the timeline? So when am I expecting to, so that I can even from that, that's the essence of that first, second initial consultation. How long am I expecting? What do I need to do? How long do we do this initial treatment? And then when do we go to the next line of treatment? So when you do all that, you're likely to get results quicker, spend less at the end of the day, and shorten your time to conception. Thank you very much.
Thank you very much, Dr. Fache. And thank you for all that you do to raise awareness, to support people trying to conceive. Is also very helpful for people to have such a supportive doctor. And of course, with Lily's testimony, she also highlighted how supportive you were and how instrumental you were in her journey. So thank you all. If you're not following Dr. Fache already, do follow him on Instagram as well, Procare Hospital. And myself as well, do follow us for updates and to reach out to Dr. Fache for a consultation to explore options that are available to you. And of course, follow Lily, the mom of Quads. So that way you can further see her pictures and the kids' pictures of her kids to inspire and encourage you as you navigate your own journey. Thank you all for being here with us today. We appreciate you spending your time with us here on Sunday. And please share awareness about this video. Let's keep raising awareness, encouraging each other as we all navigate our journeys, and removing the stigmas attached to fertility struggles and pregnancy loss in our society. Thank you all for being here, and enjoy the rest of your day.
Thank you. Thank you.
Thank you.
Bye.
Bye.
Bye, everyone.
Bye.